Okay, this slide is just again another helpful link for an article that you might find interesting and with a little extra information. Not something you're required to know for the exam. Okay, the next stage is neonatal. The neonatal stage is from the first 28 days of life following birth. It's a major adjustment time. The neonate's focus is on achieving equilibrium by stabilizing all major body systems. On page 206, table 10-4, you can see some of the characteristics that occur during the neonatal stage and some of the nursing considerations. Some of the most important being that the heart takes over for the circulatory function from the umbilical cord. So you must be constantly assessing the neonate's cardiovascular system. Gas exchange shifts from the placenta to the lungs. So immediately after birth, you have to hold the neonate's head lower than the body to allow fluids that may block respiratory passages to drain. Respiratory reflexes are activated within seconds of birth. You have to resuscitate immediately if spontaneous respirations do not occur. The neck and shoulder muscles are weak, so you must support the neonate's head. The temperature regulating mechanism is immature, so to conserve heat, you have to dry the neonate immediately after birth and place in the warm bassinet and put a stockinette cap on the neonate's head. Ossification is incomplete, so you have to remember to protect that anterior fontanelle on the neonate's skull. Visual acuity is poor, and the visual focus is generally rigid. So you have to teach parents to be directly in front of the neonate, about 9 to 12 inches from the face, when they communicate. Reflexes direct the majority of movement, so you have to teach the parents to recognize the neonate's protective reflexes. The full-term neonate has some limited ability to hold the head erect and is able to lift the head slightly when lying prone, so that you have to remember to support the neonate's head and neck when you lift them. Crying is the neonate's way of communicating, and there is a reason when they cry. So you have to teach the parents about the dynamics of crying so that they will neither label the neonate as fussy nor develop the misconception that they are inadequate caregivers. The bonding process begins shortly after birth, so you are to encourage parents to distinguish the various cries. Encourage the parents to interact with the neonate during every contact: feeding, bathing, changing, cuddling. And neonates learn through sensory experiences. Learning is enhanced in an environment providing stimuli without bombarding the neonate, and learning occurs by repeated exposure to stimuli. So you must encourage the parents to provide frequent sensory stimuli, such as touching, talking, and looking at the neonate in the eyes. Again, bonding, make sure that that's the attachment between the parent and the child, and it begins when they make eye contact. It's the foundation of trust that is necessary for future interpersonal relationships. The significance for nursing during the neonate stage is a thorough assessment immediately after birth, again with encouraging those parents to cuddle and maintain eye contact. Wellness is the most important nursing activity in the neonatal wellness teaching. Again, providing a physiological status assessment, providing a warm environment, monitoring nutritional status, providing a clean environment, and promoting parental interaction. Now, for bottle feeding, you have to remind parents or teach parents to never prop a bottle, to never warm a bottle in the microwave, and to not use bottles as pacifiers. For safety, it's totally dependent. The baby is totally dependent on others, and it's the primary concern for infants, for neonates. Neonates. You have to teach about car seats. The World Health Organization says that the primary cause of neonatal deaths is premature birth weight, low birth weight, and infections. So hand hygiene. Infections are a serious concern. You have to make sure that the baby is not around anyone who's sick. You have to maintain skin integrity by changing the diapers ASAP, treating diaper rash, make sure that the baby gets bathed, that there's lotion and protective creams. The next stage is infancy. It's the end of the first month to the end of the first year of life. It's a continued adaptation process. Rapid growth and psychosocial development occur. You focus on safety, preventing infection. You teach about incorporating the baby into family. On page 207, table 10-5, we go through the infancy stage growth and development dimensions here. So characteristics are physical growth is rapid. Birth weight usually triples by age 1, and length increases by approximately 9 inches. So you have to teach parents about developmental norms and about the importance of follow-up appointments for growth and development. All body systems move toward maturation, so you encourage the parents to have recommended well baby checks. Teeth begin to erupt at 4 to 6 months. The brain grows rapidly, and it reaches approximately half the adult size. And the eyes begin to focus, so you provide visual stimulation. Physical maturation allows for development of motor skills. So you're going to teach the parents anticipated ages for various motor skills development. Also at this time, their primitive reflexes are replaced by movement that is more voluntary and goal-directed, and the motor skills develop rapidly. At about 6 months, they roll over voluntarily. At 8 to 10 months, they crawl. At 8 months, they sit alone. They grasp objects and are reflexive for the first 2 to 3 months, and that gradually becomes more voluntary. So again, you have to teach parents all of those things and what's appropriate for the age. Psychosocially, for Freud, this is the oral stage. Babies seek immediate gratification of needs, and they receive pleasure and comfort through the mouth, lips, and the tongue. You have to encourage parents to provide toys and objects for sucking and teething that are designated for sucking and teething, not just handing them any old thing. For Erikson, this is the trust versus mistrust stage. It's the beginning of a sense of self, and they respond to the caregiver's voice, and separation anxiety develops at about 6 months. For those things, for Erikson's things, you have to encourage parents to feed promptly and consistently on demand rather than on a fixed schedule, and you have to promote trust by providing warmth, diapering, and comforting. Piaget says that this is a sensory motor stage and that infants learn by interacting with the environment. You should encourage parents to provide a variety of sensory stimuli, visual, sensory, auditory, and tactile. Language development includes babbling, repetition, and imitation. And at 8 to 10 months, infants learn to say mama and dada. You encourage caregivers to talk to the infant and to name objects that are the focus of the infant's attention. According to Kohlberg in the moral dimension, the pre-conventional stage, parents should start teaching by role modeling the difference between right and wrong. And then for spiritual, it's that stage of undifferentiated faith. Encourage caregivers to model the values they want the infant to learn. The significance for nursing in the infant stage is teaching growth and developmental aspects, developmental milestones, nutrition, the promotion of sleep, which includes a quiet environment, to provide comfort and security, to schedule activities around sleep, and to establish routines. You teach about the different formulas available, and that they're going to introduce solid foods at 3 to 4 months, and that the first solid food that they should introduce is rice cereal. No whole milk before the age of 1. No honey either. Infections and immunizations are something that you should be concerned about. You should be an advocate for immunizations, remembering that it is the recommendation and that the parents have the final decision. Remind them that diseases like pertussis, TB, and polio are on the rise due to lack of immunizations. Safety at this stage is mostly due from injuries and death from motor vehicle accidents. Remind parents and teach parents about proper car seat usage. If they do not have a car seat appropriately placed in their vehicle, they need to be taught how to. And you can't run down as the nurse and check their car, but they can go to local police departments, local fire stations, and local health departments to help them with proper car seat usage. They have to be taught that infants should be kept away from things that can cause burns, stoves, heaters, fireplaces. They have to protect them from falls. Crib rails should always be up. They should never leave them unattended on furniture. That you should use baby gates or barriers to block stairs. They have to be taught to prevent drowning, that they never, never leave an infant alone near water. To prevent electrocution, they have to keep electrical cords out of reach, and they have to use the plastic safety plugs in the outlets. To prevent choking, they have to closely monitor while they're exploring, because aspiration is common during this oral phase. Remember, kids want to put everything in their mouth at this stage. The next stage is the toddler stage. The toddler stage begins at about 12 to 18 months when they begin to walk, and that's goes to about age 3. The family should be promoting language and teaching toileting skills. The toddler becomes more independent. Temper tantrums result when autonomy is not allowed. This stage is often called the terrible twos. You have to teach parents again about those developmental concepts, give them realistic expectations, and help them understand the need for firm limits. As the nurse, you have to remember that children are sensitive to strangers, and you have to establish rapport with play. The major stressor at this time is separation anxiety when they're hospitalized, and you again lessen the anxiety by teaching via play. Now, the toddler stage is on page 210 and table 10-6. In the physiological dimension, parents are taught about the overall growth rate slows, and by 24 months of age, weight is usually 4 times what it was at birth. You have to instruct the parents on the need for vitamin D, calcium, and phosphorus. The brain grows rapidly at this time, and the bones and the extremities grow in length. Physiological development or physiological readiness for bowel and bladder control develops. Explain the timing for toilet training and the need for consistency and patience. Kids learn to walk, run, climb stairs, jump, ride tricycles, and throw balls. You have the parents assess the home environment for safety. Psychosocially, Freud says that this is the anal stage. You have parents avoid overemphasis on toilet training. They receive pleasure from the contraction and the relaxation of the sphincter muscles. It's also the autonomy versus shame and doubt stage. You have to teach parents to encourage the toddler's attempts at independence. Allow them to feed themselves. Allow them to dress themselves. This is the pre-operational stage according to Piaget. Kids in this stage, can follow simple directions. So you instruct parents to give them only one direction at a time. The thought processes are concrete, and they are able to participate or anticipate future events. So you use the calendar to show them today's date and the number of days until something significant, until their birthday, until Christmas, until Thanksgiving, until someone else's birthday. They do have a short attention span, and they comprehend self as a separate entity. So you teach caregivers the importance of calling the child by their name. At approximately 1 year of age, the child can make 2-syllable words like mama and dada. So you have the caregivers talk to the child frequently, but avoid baby talk. By age 3, the child can form short sentences and has a vocabulary of about 900 words. This is also the pre-conventional stage, and parents should consistently set limits. And the child learns to distinguish between right and wrong, and there's an emphasis on the significance of modeling the significance of modeling to get the desired behavior from the child.